Abigail Mawani.
And I am Bianca Lauria.
We will be a host today on Just Kids Health,
where we give healthy tips for growing kids.
We are really excited to present you our amazing guest,
who will be sharing her touching stories.
Ladies and gentlemen and kids of all ages,
please welcome Dr. Bianca Lauria, mental health specialist.
The biggest influence in my decision to become a doctor was from my father, Dr. Mario Lauria. He strongly encouraged me to pursue this awesome career. The earliest memory I have of his influence was about age 10. He was called in at the local hospital and took me along. Upon arrival, I realized that there had been a motor vehicle accident in which a family was involved. My father provided instructions to the medical team. A young daughter, no more than 4 years old, with minor injuries, was quite frightened and crying. While the family was being attended to, he took her in his arms and carried her around the hospital, consoling her until she settled. I followed at his side, and what stuck with me was the difference his compassion and care made for this young girl and family. Once I became a doctor, I was fortunate to enjoy many more memorable moments. But what catapulted my career in mental health was one patient who, in my mind, spoke for so many others. While I was practicing as a community-based family physician, I began to dabble in mental health research at Dalhousie University. I remember an encounter with a very accomplished middle-aged man who enrolled in the study. He anxiously asked me to clearly write on his chart not to contact his family, nor his family doctor, of his participation in the study. He explained that for years, since his childhood, he suffered and felt weak and ashamed, experiencing a mental illness. He also admitted that this was the only way he felt he could conceivably get treatment. This opened my eyes to the fact that we can have the best treatment programs and options, but if we can't get people to the table to ask for help when something doesn't feel right, they can't get help. People who experience mental illness report that often the stigma of mental illness is worse than the illness itself. In the last 20 years, I focused my career on mental health and mental health-related stigma development of awareness programs and training for various target audiences. A healthy mind controls how we feel, think, and behave, can affect our physical health, and is just as important. It's important to start identifying with health as both physical and mental health. The advice I have for parents is that every child is different. Many youths, as they grow, may be confused about their feelings, thoughts, and how they behave. At home and in schools, questions such as, what is good mental health and well-being? What should we do to have good mental health and well-being should be as commonplace as nutrition or heart health, explored and openly discussed. Educate yourself on what is expected emotionally as a child grows. Many changes are part of growing up, but as parents, we panic and worry that something is wrong. Also, know when it's time to seek help from a professional without shame. Teach them that confusion is expected. They don't have to hide and endure pain alone. And there is no shame talking about emotional problems or experiencing mental illness. If kids learn to identify and express one's feelings, to share, to listen to others, appropriately express anger, to cooperate, be assertive, and accept differences, they will feel comfortable talking to a trusted adult. Many emotional challenges could dissipate or be alleviated, and they will be better able to resolve conflicts and confront future challenges. Moreover, if you notice a change in your child, reach out to them and ask them how they're doing without judgment, and that you're there to support them. You may not be able to fix the problem yourself, and many children don't need you to fix the problem. They just want to be heard. Ideally, a greater understanding and communication within a family unit would decrease confusion, worry, and ultimately mental health-related stigma. This requires educating kids in the early learning years, where multiple teaching moments for positive character trait development occur. In closing, I commend Just Kids Health to undertake such a great initiative to empower kids, not only in the realm of health, but by seeking inspirational people to hopefully inspire kids to follow their dreams. I'm happy to be part of such a community.
Thank you for watching and have a great day.
Don't forget to subscribe and leave a comment.
And ring the bell.